Thank you very much. And I'm also an FOZ. Does anyone know what that is? A friend of Zulfi. It's, but it's not why I'm here. And actually, when I'm done, I may not be an FOZ anymore. So I just want to say how humbling it is to be here with all of you in terms of the awesome work that you're all doing. I think this forum is an amazing idea. Hats off to Kimber and to Patrick and to your whole staff who developed this. And thank you very much for this invitation to address this very distinguished group. You know, your work on investing in young children really does have the potential to change the world. As an IOM member, it's really a privilege for me to be able to contribute in this small way to your incredibly important work. I should say right up front that I don't consider myself a technical expert in early child development, but having the privilege to lead an organization that's invested so far $28 million into this field, and we're planning to do much more on this challenge, I'm very, very interested in making sure your initiative succeeds. And you can see some of those $28 million of investments in a framework I'll come back to on the handout that I've given, which is up on this slide. I also want to acknowledge really the brilliant leadership on this challenge of my talented colleague Carly Silver and also Dominique McMahon, who've been working very hard on behalf of Grand Challenges to integrate into your work, and just want to acknowledge them. But having started off that way, today actually I don't want to focus on success. Where I want to focus is on the issue of failure. And the reason I want to do that is that I think acknowledging failure is likely the most central element in an ultimate success. So at the beginning of a series of workshops, what I actually want to do is focus on what I see is potentially a collective failure of our whole community, and I call it lost in translation. And I'll describe what that is in a moment. I just want to say up front that when I talk about failure, I see it as a really good thing. And my favorite characterization is that Disney film, Meet the Robinsons, you know, where the family is around the dinner table one night, and the father says to the son, "Let's congratulate Louis on his brilliant failure." And it's exactly in that sense that I think that we are failing in a particular way that I'll specify. I also want to be clear up front that I think this field is full of amazing people doing amazing work. So when I talk about failure, it's in no way a critique of these individual efforts that have been awesome, but rather an acknowledgement that I think we are not where we want to be in terms of results in a particular way that I'll describe in a moment. And my only reason for focusing on failure is because I think we're capable of a huge win in child development. But I don't think we're going to get there unless we acknowledge where we're at, where we're doing well, and where we need to do better. So where do I think we've failed? I think we've failed to translate the emerging evidence in early child development that is being so interestingly synthesized by this forum, the science, the empirical evidence from clinical studies, the economics, into commensurate attention on the part of policymakers. And that's what I mean by lost in translation. The scope of the Child Development Challenge, which we call Saving Brains at Grand Challenges Canada, only to put it in apposition to this incredible emphasis on saving lives, is not reflected, in my view, and I'll try and prove this, in the global policies and accountability frameworks that are going to guide what plays out over the next 15 to 20 years. So my hypothesis is that ECD is lost in translation. So let's start with what the evidence tells us. On the one hand, what's at stake? I mean, simply put, and again, keep in mind I'm not a technical expert, but as I synthesize the evidence, it seems to me that child development is one of the world's grandest challenges. It really is, in its scope, in its scale, in its impact. Not getting the early years right as many of you have actually shown in your work, leads to lower wages and GDP, so it's a serious issue of economics for countries, higher rates of criminality and conflict, so it's a serious issue of the social fabric, and also higher rates of non-communicable disease and depression. I like to say that even if you didn't care about the health outcomes of non-communicable disease and depression, I mean, the economic and social outcomes of child development are extraordinarily dire. Now, if we don't pay attention to child development, what this in effect means is we're killing entrepreneurs, creating criminals, and promulgating sick and depressed populations. You can't really have a challenge where there's more at stake than that, I don't think. This inattention to child development in policies and programs is tearing apart the socioeconomic fabric of countries. Not paying attention to early child development can lock countries into poverty, while focusing on it represents a potential exit strategy from poverty. And here, let me just remind you what people hate about foreign aid. What people hate about foreign aid is they don't see an end to it. They just see it as one charitable contribution after another, after another, after another. Here, with child development and growing human capital, you've actually got potentially an exit strategy from that thing that people hate about foreign aid. I mean, I would go so far as to say, and this is a bit of an overstatement, why bother focusing on primary and secondary education if you're already walking up the down escalator? I mean, you're already going the wrong way on the treadmill by the time a child gets to school if you don't pay attention to early child development. Child development is the bridge between maternal and child survival and primary education. In some ways, it's actually the first skills training program that a country can have to build its workforce. And in short, child development really, I think, is one of the grandest challenges of our time. So there's an incredibly compelling case on the challenge of child development, and that's the evidence you're synthesizing here. On the other hand, let's have a look at how this incredibly compelling case and this compelling global challenge has been translated into global frameworks for action. Well, for starters, let's have a look here. This is just a quick snapshot of the post-2015 process, kind of where it is now, the focus areas of the Open Working Group, which is the successor to the MDGs and will guide global action for the next 15 years. And again, let me acknowledge, I know many people in the room have been working hard to get child development into this framework. And in fact, as you can see from this slide, child development is in this framework. If you go under each of these headings, if you click on the agriculture and nutrition heading and you go down one level, it does explicitly mention stunting. If you go to the education bullet, it does explicitly mention early child education. On the health bullet, it mentions a number of things closely related to child development, like sanitation and vaccines. Under peace and conflict, or peaceful and nonviolent societies at the end, if you click down, it explicitly references protection of children against abuse and against violence. So it's all there, but I want to argue that child development is really sliced and diced in this Open Working Group framework. It's not viewed in any holistic manner. It's not seen for the grand challenge that it truly is. Now, you might say that the world has many, many problems. Energy poverty, joblessness, environmental challenges, and that's certainly true. So in the face of these, you might argue, it's difficult for child development to emerge as signal amidst all that noise. Okay, well, to test that contention, let's have a look at the MNCH-specific frameworks for accountability. So here's a picture of the countdown framework, and Zulfi is very much behind this, and he's actually done amazing work, and I hope I still will be an FOZ when I'm done here. He's putting his fingers down. And this slide I actually borrowed from Tarun Dua, who I think is here in the room. When you look at this countdown framework, it actually, there's no question that child development is here, but it's implicit. One of the main outcome indicators here is stunting, which is related to child development, but I would argue maybe more towards the biological nutrition set of risk factors. I think we could argue about that. And also many of the same health interventions that are tracked in the countdown framework affect both survival and health and development. So there's no question that it's here, but I think it is implicit. Does this framework reflect the social and economic significance of child development? I would argue not yet. Now, I'm not arguing that survival is not important. Survival is obviously critical, but I would argue that it's necessary and not sufficient. And I think we need to revisit this framework from the lens of child development, as Tarun Dua showed yesterday, and you see some of her suggested indicators there. I'll come back to the issue of indicator burden and proliferation, which is obviously a core issue related to the line of argument I'm making here in a moment. Now, as an aside, just while we're talking about women and children's health, I might say that I think as an MNCH community, we have actually shot ourselves in the foot with our focus on survival as our core message. This point was made to me most eloquently by Vishwajit Kumar, who pointed out that the mothers he works with in Srivgar do not want their children to just survive. They want them to thrive. Now, if I asked Kimber, how are you doing today? And Kimber responded to me, I'm surviving. That is such a de minimis answer, and yet that is the bulwark of our communications messaging around women and children's health. I want you to think about your own children. How many of you here have children? Raise your hand. And raise your hand if your primary goal for your child is that they just survive. I was talking last night with Gillian, and Gillian made the excellent point. She said, listen, people are always telling me, we got to focus on survival now. Let's focus on child development when we get the survival job done. And she said, look, I'm a mother. I have children. I'm not going to wait till they're 5 to focus on their child development. And I think she's got an excellent point there. So I want to argue that to be more effective, we should actually pivot our communications in women and children's health from pushing on the message of survival to actually pulling through a more aspirational goal and a more aspirational narrative and more aspirational language on thrival, because that resonates with what people want. Now, before I go on to discuss why I think we've failed, and you can see I'm presenting this in the humblest and nicest spirit to try and generate discussion and move us forward, and what we should do to succeed, I want to just once again remind you that I'm in awe of the people in the room, and I'm not using the F word here, failure, in any way to diminish that. Also, I just want to do a reality check. Is there anyone who wants to challenge the fundamental hypothesis here that on the one hand, we have this incredibly compelling grand challenge. On the other hand, it is not reflected in the world scorecards and the global frameworks for action. Does anyone think that's not true? Because you have to kind of accept that now before we go on. Okay, maybe in the discussion period we can have, I'd be very glad for any pushback, because if I'm wrong, it's fantastic. Now, let's try then to look at a bit of a root cause analysis of why we've failed, why we have this phenomenon of lost in translation, why we haven't translated this incredibly compelling global challenge into concerted global action. I see 5 reasons. You may see others, and I think they offer the implications for action. Firstly is the fragmentation of risks. We know that the causes or risk factors in child development are extraordinarily complex and multiple. Everyone has their favorite risk factor. The nutrition people are fighting for nutrition. The vaccine people are fighting for vaccines. The early child education people are fighting for early child education. On this slide, you see how our Saving Brains program has actually been risk agnostic. And that's the approach I think we have to take. You know, it doesn't matter to us when we're supporting grants whether the causes or risks are biological or health related, for example, related to nutrition, related to infection, related to environmental toxins, whether they have to do with environment, enrichment, and nurturing, or whether they have to do with the terrible things that happen to children, abuse, neglect, conflict. We're risk factor agnostic. You know, it doesn't matter if your brain is messed up due to biological factors like nutrition or infection, or psychological factors like stimulation learning or protection factors. You know, if you're in the real world, it doesn't matter if you're well nourished, if you're a child soldier, or if your parents don't sing to you or read to you, or you aren't able to play. You will be just as impaired. So we need to take a holistic and integrated view of risks. So I think that's the first reason why we haven't really been able to get this translation done. The second reason, I think, has to do with the disciplinary siloization of the outcomes. So some of the relevant outcomes are economic, like earnings, GDP. Some are social, like violence and criminality. And some are health-related, like NCDs and depression. The economists like the economics outcomes. The sociologists like the social outcomes. And the health researchers and the health folks naturally like the health outcomes. But then what happens is by focusing on only one element of the burden, we minimize it. We need to see this problem holistically for the multifaceted, huge burden that it poses. The third issue I want to zero in on in terms of the cause of this loss of translation is the issue of metrics. And I know you had a lot of discussion of it yesterday. And I would characterize this as starvation in the midst of plenty. On the one hand, we don't really have good metrics of child development early on when it really matters, let's say in the first year of life or in the first 2 years of life. And therefore, we're left with this time lag with no prognostic indicators early on. And let me just give a shout out to Gary Darmstadt, my friend, and his colleagues at the Gates Foundation, who recently launched a grand challenge on identifying ways to measure early child development, infant and fetal development, to try and really stimulate some creative thinking on these early indicators. So on the one hand, we don't have the early indicators. On the other hand, we've got plenty of metrics, you know, especially later on, from plenty of different organizations. So here I just want to reference Joan, who challenged us yesterday. She said, and I think this is absolutely right, we need the 6 metrics that fit on a dashboard that the policymaker can track in her country. And these metrics need to be harmonized between health and education and protection and along the life cycle. And we need to become adept at measuring context alongside development outcomes when evaluating the impact of these interventions. So I think that's exactly right. Now, my conclusion there then is that we need to fix this metrics problem. Why do we need to do that? We need to do it in its own right, but metrics is also the gateway to accountability, and that is how we drive global policy. I mean, if you're with the trying to influence one of these frameworks and they tell you how do you want to measure it, and then you have 6 people from different organizations show up and say, well, here's our set of 17 measures, and here's our set of 24 measures, and here's our set of 13 measures, I think you can just forget it. The fourth reason I think we're not doing as well as we could be on translating this grand challenge into policy action is, let's call it politely, political economy. When we say child development, many politically astute observers will hear big government and big spending. And this automatically leads to a political divide that makes the challenge much more difficult to address. We need to take another look at child development from the standpoint of a fiscally conservative approach. Sometimes it could be child development, here's your $75 billion. Sometimes we ought to take another look, and in this regard, I think it's very, very significant that Secretary Clinton's initiative, Too Small to Fail, that is actually not about big spending. It's about simple things like the word gap in children and tweeting lessons that parents can, things parents can do to actually close the word gap and improve the development of their child. I just want to remind you that it doesn't cost billions of dollars in government spending for a father or mother to sing to their child, to respond to their child, to play with their child, or to set up a space for their child to play. I fully recognize the issue of invoking burden on care providers here, but I do think that we need to break this pari passu linkage between child development and big government spending programs. And building on this, I think we need to pay a lot more attention to innovative finance mechanisms in cases where you actually do need programs very significantly financed. And that burden is going to be very, very hard for governments alone to bear. Corporations benefit greatly from workforce development and so on. I mean, even think about a mining company. A mining company goes into a country, and arguably on the balance sheet of a country, and I'm thinking about that work on balance sheets of countries that was published in The Economist a couple of years ago, it's taking money out in natural resources. It's trying to mitigate in the environmental asset category. But there's a human capital category where a mining company could really be replenishing. So on balance, the effect on a country's balance sheet is neutral or positive. There are very compelling arguments, I think, for corporations around workforce development in terms of this. And that's why I think the type of innovative financing mechanisms, be it development impact bonds or other mechanisms, zeroing in on early child development are really something to look at. The fifth reason I think that we're failing is the issue of how do we get to a truly global or universal challenge. If you listen to President Obama's last State of the Union speech, you will have heard his recounting of 50 years of the war on poverty and his $75 billion for early child development. But that narrative around the US war on poverty and the effective interventions therein in early child development comes completely delinked from the global challenge of child development and the issues of international development and how countries can develop their infrastructure, their human capital infrastructure, to exit from poverty. This is very ironic because the whole point of the post-2015 goals, as opposed to the MDGs, is that they ought to be universal goals. At the same time, it represents a huge opportunity to link the domestic problems that G8 and other high-income countries have, because every country has poor people in it, with the broader problems of global poverty and how child development can be zeroed in on as a strategy there. So the idea of universality and a truly global goal, I think, is something we should look at. So where does this leave us with respect to our important work? Well, I think it actually should leave us encouraged. And I think what this forum is doing is exactly on the right track in terms of synthesizing the science, synthesizing the empirical evidence, synthesizing the economic data on child development. I'd love to see, for example, and this gets to the point of we have to think about how those messages are translated, economic data on child development. What's the total bill for neglecting this global challenge? We know that it's 200 million children, or thereabouts. What is the total cost of inattention? That's the topic of the workshop. Maybe we'll get the answer later. If you zoom in on a particular country and you click on that country, what is the cost to GDP of that country from not paying attention to child development? If you click on that country and you zero in on a particular risk factor and click on that, what is the cost in that country of neglecting that risk factor or a group of risk factors? That's the type of translational evidence that I think is going to be a compelling argument to finance ministers. But that kind of evidence is only the start, because you need evidence plus some of those advocacy elements to actually get the job done. So what I'd love to see is, let's see these risks and outcomes holistically. Let's develop a few easy-to-measure metrics, as Joan was saying yesterday. Let's try and sever the pari passu link between child development and big government spending. And that's not to say that I don't think the government should spend on this. I think they should. But I think that pari passu link is getting in our way. And let's see this as a truly global challenge. Let's not disconnect the US war on poverty from the work that's being done in our global development agencies. Let's see this as a truly global challenge. Let's continue to build a coalition, a type of partnership that can tackle this, because fragmentation of our effort, and this is, I think, a great service that this forum is doing, kills hope for children. At the tactical level, I'm sure there are many things that we can do and think about in respect to these women and children's health frameworks, in respect to the post-2015 accountability frameworks. You know, what is our tactical play for UNGA 2014, the UN General Assembly, just as an example. But I really wanted to tackle this problem at a more strategic level. I certainly don't have the answers here, but I did want to highlight what I saw as a collective problem, which is ECD being lost in translation between the evidence base and the global frameworks for action. I think, and this is why I spoke in this way, if we continue to ignore this failure, we will continue to get the same results. Let us each reflect soberly and suggest the way forward as you think about, as you have these discussions today and at these workshops. And again, I think the forum provides a great opportunity to do just that. So the issue should not be a picayune discussion about, you know, this little bit versus that little bit. It should be that as well, because the job of this, of the National Academies, is that kind of evidence synthesis. But while we're doing that, let's at the same time always remember how these messages will be translated to policymakers. Now, I do have actually cause for great hope. There will be a day of reckoning soon, and it'll come before September 2015, for the post-2015 goals and indicators. There's actually no way that you can implement a framework that looks like this with, you know, underneath it, it's like everything is underneath it. So there's two ways that the end game is going to happen for these indicators, in my view, assuming that that end game will even be successful, and there are default scenarios where it won't be successful. One way is an actor will come along and be so compelling that they'll be able to shape some of these goals, and people will come along with that actor. The second way, though, is that a narrative can come along, that actually it can be seen to unify these goals in a way that helps to provide a coherent story. Because at the moment, there's absolutely no coherence to this story. It's like a long laundry list, a very good laundry list, but a laundry list. I want to suggest to you that we have a great opportunity to help unify these metrics through a theme like reaching potential. A thematic like reaching potential actually embraces all these themes in a coherent manner. You can reach potential in employment. You can reach potential in governance, just as you can reach potential in women and children's survival. And if you frame this challenge that way, reaching potential, human promise, whatever the best message for that is, these indicators actually all fall in line, and it valorizes the topic that we're all interested in, child development, saving brains. You know, child development and saving brains should not be a series of footnotes on the world scorecard. It's just so important. Rather, it should be recognized as the grand challenge that it really is. So I want to thank you for your attention. I hope I can still remain a friend of Zulfi, even though I came with a relatively critical lens. But I came with a critical lens talking about failure only in the best spirit to focus us on something early on where I think if we really pay attention to this issue of lost in translation, all the efforts of this forum and all the individual awesome efforts of the people in the room can really be amplified much more greatly going forward. So thank you very much, and I think we probably have just a couple of minutes we're still on time. We have a couple of minutes for questions. So thank you very much for your attention. Much appreciated.